March is Pharmacist Awareness Month, and right now we're hanging out at the Medical Arts Pharmacy downtown Saskatoon. Right now I'm joined by Amy, and she's a pharmacist here. Now, Amy, we're going to talk a little bit about this month. It's not so much to tell people that pharmacists are in the community, it's to tell people and community members what pharmacists can do for them. So I know that's come a long way over the years, so tell us a bit of the newer things that pharmacists can do for the community.
I think the big change and something that's been coming up in the news is that pharmacists are doing some prescribing now. It's not prescribing in the way that your doctor does, because your doctor is kind of a specialist in diagnosing, whereas we are specialists in medication management. So what we've sort of done is come up with a plan to just empower patients to have a little bit better access to services when it comes to things that are, more minor health conditions, things that you probably know you already have. So, you've got tingle going on, you got a cold sore coming, and that cream that you can buy at any pharmacy isn't working for you anymore. But that pill that the doctor prescribed for you that one time, boy, that worked awesome. So basically all you need to do is come into a pharmacy now instead of making an appointment, sitting in minor emergency, or sort of taking up that time, because you know what it is already. What we're going to do is help you with the medication management of that. I'm just going to ask you some questions, say, is this really a cold sore? Is there nothing else more serious going on? And if it's the right therapy, then we're just going to prescribe those pills that worked for you last time.
Wow.
There's a few different health conditions that we're doing. It's certainly not everything yet, because of course these are things that have been deemed appropriate. And so there's about 10 of them listed on the Sask Pharmacist website that people should check out. Things like acne or diaper rash that you just, again, that thing that the doctor prescribed worked really awesome, but you don't really want to go and sit and make an appointment.
Saves so much time.
Exactly, exactly. The other thing we've been doing too is, you've been on a medication for 6 months, and your doctor's appointment is a little bit more than a month away, and you need just one more refill. That's, I think, a pretty appropriate context where we can just give you just a little bit more to get you through. Or, if there's an emergency situation, you left your medication at home and it's asthma and you're having an asthma attack, you can come into a pharmacy and we can just get you set up. And again, it's just increase of access to all of the services and trying to, balance the weight of the responsibilities across the healthcare board, because of course we know just how busy things can get in those minor emergency rooms, and we need to free up that doctor time for those really important diagnostic services. And when it comes to just choosing the right medication for the right person, that's something that we're more than capable of doing.
Before we wrap up here, Amy, what do you want the community members to get out of Pharmacist Awareness Month?
You know what, I just want you guys to go into your pharmacy, let them know that, you're my pharmacy and I'm your patient. Let's get to know each other. Find out what they can do, what's best suited for you, and definitely just access those services. If you don't know why you're on a medication or what it's for or what its side effects are, or you want to know things that you can be changing in your lifestyle just to get yourself healthier, I mean, we're definitely the right place to come.
Fabulous. All right, well, there you have it. Make sure you go to your local pharmacy or come see Amy down here at the Medical Arts Pharmacy. Don't go anywhere. There's lots more coming up on today's Go Saskatoon.